I'm Jeremiah Hopkins, third year psychiatry resident at ETSU, and I'm here to be on the shrink tank to talk about mental health issues.
Welcome, Jeremiah.
Thank you. I'm glad to be here.
Nice to meet you. You seem a little tense right now. Just relax.
Just relax.
You're in the presence of Mr. Wonderful.
Yeah.
All roads lead back to Mr. Wonderful.
All right, Jeremiah, we have a few questions for you. How did your training influence the way that you view and are sensitive to mental health issues?
Well, my training is very focused on mental health issues. It's a big part of the job in psychiatry as well. It's something we really have to be aware of.
How did your training influence the way you provide mental health services?
Well, in providing mental health services, you really want to take a view of the patient as a whole, and you want to see if it's a medication problem, if it's a social problem, or if it's something else going on. Sometimes you're a little bit of a shrink, sometimes you're a little bit of a therapist, sometimes you're just a neighbor and somebody to talk to.
I like your pun.
Yes. You know, So, Jeremiah, I was reading over your application and I read that you were from Appalachia. Is that true?
Yes, I am. Originally from Watts, Virginia, in the southwestern part of the state.
Okay, well, can you tell us, how do you think your cultural values and where you were brought up influence your beliefs about mental health and treatment of mental illness?
I believe it influences it in several ways. I feel like I have a connection to people I serve in this area. I feel like I can understand some of their reservations and why they might be afraid or not want to seek mental health treatment in the beginning stages of illness.
Tell me more about that.
Well, in some cultures, some sects of the culture where I'm from, there's distrust among mental health care providers, psychiatric providers, especially if it's provided from somebody from outside the region. So I've been around a lot of people and seen that trust, and many people express that trust in my past.
That was a great answer. Thank you. Jeremiah, what factors do you consider when deciding which patients to refer for psychotherapy?
The most important thing for me is motivation. If it's a patient that's not motivated, they're not going to show up for therapy sessions. And it's hard to do therapy when they don't show up. If it's somebody who could benefit, has a very high degree of interest in coming in, those are the patients I look for.
Hmm.
So one more question for you. What would you like to know more about psychotherapy to make more referrals?
Well, to be honest with you, what I'd really like to get back is more feedback on the patients I do send over. I send a lot of patients over to psychotherapy, but I very rarely get feedback on which ones are good patients I'm sending, which ones are bad patients I'm sending, and I think that could really help me in sending better patients over.
Well, I think there's actually more questions, Mr. Wonderful.
I think there are a couple.
Let's go on, okay. Well, what else would you like to know about psychotherapy that hasn't been covered in your training?
Well, for psychotherapy, I'd really like to see a little bit more hands-on experience, a little bit more examples of psychotherapists that work, because I think I get a good grasp of the theories behind things, but we don't get a lot of opportunity to actually see what psychologists do in the room with the patient.
In vivo exposure. Okay. And one more question. What would you like psychologists to know more about what you do to improve our interprofessional relationship?
You know, try to do a lot of things. We try to coordinate care with the psychologist. If they're focused on one issue, I don't want to be telling them something different and get them confused. And it comes on a day-to-day work as well. You know, you want to see them in the hall. If there's a problem they have, you want to be available to them, and you want to make sure they have your phone number so those lines of communication stay open.
Great pitch.
Yes.
Very impressed.
Well, we're going to have to talk amongst ourselves and see if we're willing to give you an offer. And so if you just step outside, we'll call you back.
Thank you for your time.
Yes.
Good luck to you.